Hello students, welcome to Clinosol's YouTube learning channel. Please subscribe our channel by clicking on bell icon. In today's video, we are going to spread a word on psoriasis. Psoriasis is not contagious, but awareness is. Good morning, doctor.
Good morning, Mihu.
The patient in room number 302 is suffering from psoriasis. Can we help her by counseling? Can you explain me what is psoriasis?
Yes, Mihu, we should help her, and it is good to understand the disease before we visit her. Psoriasis is a chronic inflammatory disease in which skin cells build up and form scales and itchy, dry patches.
What is the cause of psoriasis, doctor?
Cause of psoriasis is not known but believed to be genetic. Several factors are thought to aggravate psoriasis like stress, excess alcohol consumption, and smoking. Individuals with psoriasis may suffer depression. Some medication can also trigger the disease like lithium salt and beta blockers.
Okay, doctor. What are the types of psoriasis?
There are many types of psoriasis, and let me explain a few to you. Plaque psoriasis. It appears as raised area of inflamed skin covered with silvery white scaly skin. These areas are called plaques. Pustular psoriasis appears as raised bumps that are filled with non-infectious pus. The skin under and surrounding pustules is red and tender, localized commonly to hand and feet. Flexural psoriasis, also called inverse psoriasis. It appears as smooth inflamed patches of skin. It occurs in skin folds, particularly in genitals, between thighs and groin, armpits, under overweight stomach, under breast. Aggravated by friction and sweat and is vulnerable to fungal infection. Gutate psoriasis is characterized by numerous small oval spots. Numerous spots of psoriasis appear over large areas of body such as trunk, limbs, and scalp. It is associated with streptococcal throat infection. Nail psoriasis produces variety of changes in appearance of toe and fingernails. Changes include discoloring under nail plate, pitting of nails, thickening of skin under nails.
Okay, doctor. Can you explain me the pathophysiology behind the disease?
Yes, Mihu. Basal skin cells divide quickly and newly formed cells become evident as profuse scales or plaques of epidermal tissue. Psoriatic cells travel from basal cell layers of epidermis to stratum corneum skin surface and cast off in 3 to 4 days, in sharp contrast to normal 26 to 28 days. Because of rapid cell passage, normal events of cell maturation and growth cannot take place and normal protective layer of skin cannot form. It appears to be hereditary defect that causes overproduction of keratin. Primary defect is unknown. The emotional stress and anxiety aggravate the condition. Trauma, infection, seasonal and hormonal changes are trigger factors. Psoriasis is said to be mild if it is less than 5% of the body, moderate in case of 5 to 30% of the body, severe if it is affected more than 30% of the body.
Okay, sir. Can you tell me some signs and symptoms of psoriasis?
Yes, Mihu. Pain, scaling, itching, pustules, inflammatory condition, and erythema are some signs and symptoms.
Sir, there is no cure for psoriasis. Are there any treatment options?
Yes, Mihu. We have treatment options like topicals, phototherapies, systemic therapies with BRM, combination therapies, and alternative therapies. Topicals include corticosteroids, vitamin D3 analogs, coal tar, anthralin, retinoids, calcineurin inhibitors, and emollients. Glucocorticoids have anti-inflammatory, anti-proliferative, immunosuppressive, and vasoconstrictive effect. They stabilize glucocorticoid receptors by induction of phospholipase A2 inhibitory proteins. Lipocortins control the biosynthesis of potent mediators of inflammation such as prostaglandins or leukotrienes by inhibiting the release of their common precursor, arachidonic acid. They are non-irritant and non-staining. Adverse effects include skin atrophy, acne, contact dermatitis, perioral dermatitis. Systemic adverse effects may occur with superpotent agents. Less commonly seen Cushing syndrome, osteonecrosis of femoral hand, cataract, and glaucoma. Corticosteroid ointments include clobetasol propionate, betamethasone dipropionate, creams, fluticasone propionate, foams or lotions, clobetasol propionate, shampoos, fluocinolone acetate. Vitamin D3 analogs stabilize vitamin D receptors, promote epidermal differentiation, inhibit keratinocyte proliferation, inhibit pro-inflammatory cytokine production, that is interleukin 2 and interferon gamma. Adverse drug reactions: burning or local irritation, hypercalcemia, hypervitaminosis D. Vitamin D3 formulations: calcitorol, synthetic preparations like calcipotriene, tacacalcitol, maxacalcitol. Calcineurin inhibitors are macrolide antibiotics that bind to FK506 binding protein to inhibit calcineurin via calcium calmodulin blockade, inhibits neutrophil activity, T cell proliferation or pro-inflammatory interleukin 2 inhibitor. Pimecrolimus, tacrolimus ointments are some example. It is used as flexural psoriasis. Adverse effects includes local burning, lymphoma or neoplastic tendency. Coal tar inhibits epidermal proliferation by antimitotic action at stratum bacilli. Adverse drug reactions include unpleasant odor, stains, clothings, folliculitis, and phototoxicity. Risk of teratogenicity in pregnancy is low with this. Formulations include crude coal tar, salitar, ultitar. Salicylic acids have keratolytic properties and it is used as shampoo or oil in scalp psoriasis. It increases corticosteroid efficacy and it is used for limited or localized plaque in pregnancy.
Okay, doctor. What phototherapy can be given?
Phototherapy has anti-proliferative or anti-inflammatory action by selective depletion of epidermal T cell by apoptosis. Narrowband UVB, broadband UVB, excimer laser. Photochemotherapy, psoralen plus UVA to enhance efficacy. Adverse effects: erythema, pruritus, xerosis, hyperpigmentation, and blistering. PUVA also have nausea and vomiting side effects.
Okay, doctor. Can you explain systemic therapies?
Yes, Nihu. Systemic therapies: aceteratin is a retinoic acid derivative, an active metabolite of etretinate. Retinoids may be less effective than corticosteroids. It is usually given in combination with topical calcipotriene and phototherapy. Dose 25 to 50 mg. The adverse effects include hypertriglyceridemia, cheilitis, brittle nails, and burning skin. Methotrexate has anti-inflammatory effects due to its effects on T cell gene expression and also has cytostatic effects. Methotrexate can be administered orally, subcutaneous, or intramuscularly. Starting the dose is 7.5 to 15 mg once weekly and it is increased by 2.5 mg every 2 to 4 weeks. Maximum dose is 25 mg weekly. Adverse effects like nausea, vomiting, stomatitis, macrolytic anemia, and hepatic or pulmonary toxicity is seen. Systemic therapies with biologic response modifiers are considered for moderate to severe psoriasis. Example: adalimumab and infliximab. Adalimumab is a monoclonal TNF-alpha antibody. It provides rapid control of psoriasis. Initial dose 80 mg and it is followed by 40 mg. Adverse drug reactions like infections, injection site reaction, headache, and rash. Infliximab, chimeric monoclonal antibody directed against TNF-alpha. It is used as psoriatic arthritis and chronic severe plaque psoriasis. Dose 5 mg per kg as IV infusion. Adverse effect includes pharyngitis, respiratory tract infection, and urinary tract infection. Combination therapy used to enhance efficacy or minimize toxicity. Topical corticosteroids with vitamin D3 analog is effective. It is less irritant than monotherapy. Taclonax, calcipotriene, and betamethasone dipropionate combination is given. Phototherapy with other topical agents such as UVB with coal tar. Alternative drug therapy: mycophenolate mofetil 500 mg 4 times a day. It has an action to inhibit DNA and RNA synthesis and may have a lymphocyte antiproliferative effect. Adverse effects includes GI toxicity, hematologic effects like anemia, neutropenia, thrombocytopenia, and viral and also bacterial infection. Hydroxyurea inhibits cell synthesis in the S phase of DNA cycle. It is used in recalcitrant severe psoriasis. Dose is 1 gram and it increases 2 grams daily. Adverse effects: bone marrow suppression, lesional erythema, localized tenderness, and reversible hyperpigmentation.
Okay, doctor. Thank you so much for explaining psoriasis in detail. Also, for telling me the treatment options for psoriasis. When we know there is no cure, it can be treatable and manageable.
Yes, Mihu. Now let's go and visit the patient.
A few moments later.
Hello, Priya.
Hello, Priya. How are you doing?
Hello, doctor. Hello, Mihu. I'm sad. I feel I look ugly.
No, Priya. You will be fine. It is common to feel depressed and have anxiety about how you look. But we will treat you and lesions will disappear and relapse rate is low if we completely control it.
Oh, doctor, it's good to hear. Doctor, can you tell me what I have to do?
Usually, if the patient is obese, then he should reduce weight and avoid trauma like physical injury, wounds or sunburn or exposure to irritating agents. Reduce emotional stress. Sunlight and sunbathing improve psoriasis except in photosensitive cases.
Yes, Priya, and you should avoid foods like dairy products, milk or egg yolks, sugar, alcohol, red meat, gluten, raw tomatoes, brinjal. And you should include foods in your diet like fruits, vegetables, example green leafy vegetables and carrots, legumes like herbs and spices, oregano or turmeric, fish with omega-3 fatty acids, seeds, nuts and other plant-based fats like olive oils and avocado. Thank you, Mihu. Doctor, my friends are not playing with me. They feel it will affect them too if they play with me.
No, Priya, psoriasis is not contagious. It is due to family history, infections, medications, skin trauma, smoking or obesity.
Take good care of yourself, Priya. Limit shower time, use moisturizer, try an itch relieving product, moisturize instead of scratching, skip hot baths, apply a cold compress. Oh sir, that's good to hear and thank you, Mihu. Welcome, Priya. Thank you, doctor.
Welcome, Priya.
Thank you for watching. Please contact us if you have any queries.